Hello, everyone. Good evening, all. I'm Dr. Cynthia. I'll be taking your role play session every week. Basically, in our role play session, we are going to discuss all the recent cases and also um, very important topic that is frequently coming in AMC clinical. So today we are going to discuss around 6 cases. Who wants to do role play? You can write your name on the chat box. Okay, let's start our session. So let me share my screen first. Okay, Dr. Annie, can you hear me? Hello, Dr. Annie, you want to perform?
Hello.
Hi.
Hello, can you hear me?
Yeah, I can hear you.
Oh, okay.
So this is your case and your 2 minute starts now.
Okay.
Okay, you can start.
Um, okay. Um, Hello, Penny. I'm Dr. Annie, one of the doctors practicing in this clinic. From notes and understand you are feeling unwell. I'm really sorry about that. How are you feeling now, actually?
I'm feeling sick, doctor, feeling unwell for a couple of weeks.
Okay. I'm really sorry for that. Did you just take the holiday from the overseas?
Yeah, doctor, I went from a trip.
Okay. Can you please tell me what exactly happened to you?
Doctor, I feel tired, I feel weak, actually not feeling well. It's very hard to describe.
Okay. So, can you please tell me, when you traveled overseas, so you use the drug heroin, is that correct?
Yes, doctor,
Okay. How did you use it? Did you just snuff it or you use the needles?
with needles.
Okay. Is this the first time?
Yes, doctor.
Okay. So, when you use needles, did you share the needles with others or you just use by your own?
Um, because doctor, I was in a party and there were my many friends were there.
Okay.
Yeah, maybe we are sharing needles.
Oh, okay.
Remember?
Uh, yeah, okay. Apart from that, when you had your holiday, and did you have some street food or some unbottled water?
Uh, no, doctor.
Okay, yeah. And do you have a tattoos or some body piercing?
No.
Okay. Um, Sorry, I need to ask you some private questions. Is that okay with you?
Yeah.
Okay. Are you sexually active?
Yes, I'm.
Okay. Um, do you have a stable partner?
Uh, Not now, doctor. Last 2 months, I'm not sexually active actually.
Oh, okay. Yeah, that's fine. Okay. So, regarding your tiredness and for how long you're having this tiredness?
Since I came back from holiday,
Okay. Do you feel tired the whole day or you some particular time of the day?
I don't know, doctor. I felt very lethargic.
Oh, okay. After any activities or even when you have a rest?
Yeah.
Oh, okay. So, any changes color of your skin or your eyes, like a yellowish colorish?
No,
Okay. Any color change in your pee or the pore?
no,
Okay. Any lumps and some any lumps and bumps around the body?
no, doctor.
Okay. Any flu-like illness, like runny nose or
Not now, but I had some flu symptoms like 2 weeks back.
okay. Did you take did you seek medical help for that?
No, doctor.
Okay. Um, any tummy pain?
No.
Oh, okay. Any loss of weight or loss of appetite?
Uh, Loss of weight. No, but appetite, yes. Yeah, I noticed it.
Oh, okay. Um, so apart from this, are you a generally healthy person?
Yeah,
Okay. Yeah. Any past medical history or surgery history I need to know?
no, doctor.
Okay. Do you smoke or drink alcohol?
I do smoke and drink alcohol occasionally.
Okay. How much do you smoke per day?
It depends. Sometimes
Uh,
six
uh,
is six per day.
okay. Yeah. So any other drugs apart from this time? Any other recreational drugs?
No, doctor.
Okay. Do you take medication?
No,
Okay. Any allergy to anything?
No.
Okay. Okay. Thanks, Penny. I just need to talk with my examiner and I'll come back to you. Is that okay?
Sure.
Okay. Dear examiner, I would like to do a physical examination for my patient.
What do you want to know?
Yeah, I would like to know, I would like to start from a general appearance. How does my patient look like?
Normal general appearance.
Yeah. Okay. And I would like to know his vitals, blood
Uh,
pressure, yeah, and pulse rate.
Patient vital is stable.
Okay. Temperature.
Febrile.
Okay. So I would like to know if my patient has any look polar or any jaundice,
No.
any lymph nodes enlargement.
No.
Okay. Um, I would like to check the I would like to do abdominal inspection. Um, I would like to check if any organomegaly, like hepatomegaly or splenomegaly.
So you can appreciate there is a hepatosplenomegaly 2 centimeter below left costal margin.
Oh, okay. Yeah, thank you. Um, okay, I would like to order some office tests, including the urine and dipstick test, blood sugar.
It's pending.
Oh, okay. Um, okay, thank you, examiner. Now I need to go back to my patient. Okay, Penny, thanks for waiting. From the history and the examinations, most likely, are you having a hepatitis C or B? Will this needle sharing you had overseas?
Hmm.
Uh, do you have any idea about this?
What's that?
Okay, that's a viral infection of the liver. It's a type C, and normally will be sharing by the needle, or can be other factors like um, yeah. In your case, it's a needle sharing, and then it can be transmitted from other people who carry this virus,
Mm-hmm.
and then yeah. Unfortunately, it's most likely caused here, and also other causes can be like hepatitis A, um, some serious condition like HIV. So we need to
Time's
do,
up.
pardon, sorry.
Your time's up.
Oh, okay. Yeah. So yeah, that's it.
Yeah. Dr. Annie, really nice performance. You have the structure. You know how to take a history, physical examination. It was nice. Few things you missed that I would like to point it out. First of all, like when you started history and when you asked me about IV drug use, so you know it's a sensitive question, isn't it? You should give me
Yeah, it is.
the
Yeah.
history. Okay,
Yeah.
but you gave me later on. That's okay.
Yeah.
But when you are asking about like that history regarding IV drug use, those type of things, so be careful about that.
Mhm.
You need to keep confidentiality. Now, coming to the history of presenting complaint, how you took history feeling unwell, it was really nice. But the thing is that patient gave you very vague symptoms like feeling unwell. Actually, patient can't describe you exactly how he feels. So you should ask like at least like you need to rule out any chest infection related questions, any heart problem, any tummy problem like that. So you totally missed all the heart related questions. Okay, so you didn't ask me any chest pain, any cough, any short of breath, those things. You asked me any flu-like symptoms, that's fantastic, but you didn't ask me any fever that I am having now. Okay,
Okay. Yeah.
those
Okay.
like infected related questions, like I would say you missed. Okay,
Yeah.
now coming to the physical examination, yeah, another thing, physical examination, you have also nice structure. You asked me abdomen examination, that was okay, but you missed again cardiovascular respiratory examination. Okay, please
Okay.
ask that one. If your patient like complain about sick, which is very vague, you never know, like it can turn into like heart condition, chest condition, like that. Okay, so try to ask like at least what about cardiovascular finding, what about rest finding. Okay,
Okay.
very good. You asked me about urine dipstick blood sugar, that is office test. Differential diagnosis, you gave me hep B or hep C. So that's nice. That could be one of your important differential because of the needle sharing and recent um, infection history. But in here, the diagnosis, I'll tell you when I'm going to discuss the case. Okay, it's
Okay.
the infective endocarditis case. So
Okay.
let's discuss the case.
Okay.
Okay,
Okay. Thank you.
no worries. Um, okay. So you are a GP, 29 years old, Penny came with complaint of feeling unwell. He returned from holiday overseas where he took heroin. So your task is take a history, physical examination finding from examiner, and differential diagnosis. So basically, this type of case, you might get MC clinical exam, and your time is limited 8 minutes, 2 minutes reading time. So that 2 minutes reading time, I would suggest like based on the history of presenting complaint, you need to think about important differential that you might not miss. Okay. Another thing, that 2 minutes, you need to think about what could be the key point in this case. And um, your time, as I mentioned, your time is limited, so you need to finish within 8 minutes. So when your 8 minutes started, follow the structure. How you need to take a history, physical examination, those structure, that detail will be discussed Dr. Ashan classes in theory case. Uh, you will know about how to take history, physical examination as well. Okay. In my role play session, I'm going to discuss random cases. In here, I'm not going to discuss with you how to take history, how to take physical examination. I'm just discussing with you random case. Okay. So here, as patient complaining, feeling unwell, so you need to think about acute illness. So always, I would suggest you need to ask about PUMA, that is pneumonia. P for pulmonary symptom, that is, you should ask about chest related symptoms. U for urinary tract related questions to rule out urinary tract infection. M for any meningitis or any brain infection related question. And A for any acute gastro, any acute otitis media, those type of questions. Okay. Because here patient gives you very vague symptoms, it's very hard to differentiate. So coming to the what could be your approach? Introduce yourself. Hi, I'm Dr. X, one of the GP who will be looking after you today. How may I help you? Like different candidates follow different approach. So you can follow your own. Okay. So after introducing yourself, if you notice you are going to ask some sensitive question, please give confidentiality. Okay. AMC clinical is bit different from the MCQ because in here, MC clinical approach matters a lot. Okay. So basically, they are looking at how you are dealing with your patient. So confidentiality must in this case because you are going to ask about IV drug use questions. Now, ask about what do you mean by feeling unwell? What happened during this trip? Can you please tell me or can you please share what exactly happened? And when you came back from trip, you should ask that one to know the incubation period of different type of disease. Okay. So patient was telling you like, yes, doctor, I'm feeling unwell for last 2 weeks or few weeks since I came back from trip. Actually, I feel lethargy, like very vague type of symptoms. Okay, so you should ask one by one questions. Okay, so what happened exactly during the trip? Patient went to a trip and party with a friend, and the time patient took heroin. So you should ask about IV drug use. Yes, heroin, and any needle sharing. You should ask how Dr. Annie asked. That was nice. So yes, there is history of needle sharing, and you should also ask like, have you ever used needle share? Okay, so here, patient mentioned, no, doctor, that happened for the first time. And as I mentioned, like then ask about details, history of presenting complaints, since when you feel tired, either is it getting worse or not, any aggravating, any relieving factor, um, anything makes it worse or anything makes it better, you should ask. Okay, other activities during the trip, like other parties. Did you enjoy any street food, unbottled water? Have you done any tattooing, ear piercing? Now ask very sensitive question related to sexual activity. So, are you sexually active? Do you have a stable partner? Are you practicing safe sex? Those questions you need to ask. Okay. Regarding tiredness, you should ask how long you feel tired. Do you tired all the day or with the activities? Okay. And do you notice any yellowish coloration of the body or eyes, any changes in your color of your pee or poo, any lumps, bumps in your body, any flu-like illness to rule out HIV related questions. Okay. For any color changes of the skin, eyes, any color changes of pee or poo to rule out any hepatitis related questions. Okay. Any lumps, bumps, or any constitutional feature you should ask to rule out HIV. Now, any tummy pain, if your patient mentioned, yes, doctor, I feel tummy pain, you should ask details. Okay. Now ask about fever related questions. So here, fever positive, you should ask when. Other like, is it coming and going or like constant? Have you measured the temperature? Any chills, any rigors did you feel? You should ask. Apart from that, you should definitely ask about any fever along with chest pain, cough, short of breath, those things. So here, fever positive, chest pain positive, palpitation also positive. Okay. Any short of breath, pedal edema, yes, that's also positive. So when why we are asking about short of breath? Short of breath, we need to rule out short of breath, cough, fever. We need to rule out any pneumonia. Okay, any chest pain, palpitation, along with short of breath, pedal edema. We need to rule out any heart failure related questions. Okay, sexual history, as I mentioned, we already asked earlier. In addition with tummy pain, did you notice any nausea, any vomiting? So no. Any changes in bowel motion, like any diarrhea, any constipation, any blood in your poo, you should ask. Urinary tract related question is you should ask any burning, any stinging feeling while passing urine, any color changes to rule out any UTI. Okay. As I mentioned, any obstructive jaundice or hepatitis related question, you should ask about any color changes as well. Apart from that, how about your general health, past medical, surgical history, SADMA? SADMA means like smoking, alcohol, any drugs use, any medication, any allergies. Okay, so those sort of things you can get to know from your theory course. Now coming to the physical examination finding from examiner. So as I mentioned in here, you need to ask about general appearance, how my patient looks like. Now ask about vital signs. So vitals basically temperature, pulse rate, blood pressure, respiratory rate, saturation. Um, you can ask about general appearance. Either your patient is looking pallor, jaundice, any lymph node, how about any hands finding or not. You can ask quickly about other feature of the face. Now coming to the systemic examination. So systemic examination, cardiovascular, respiratory, abdomen, you need to go in this way. So cardiovascular, because our time is very limited, you can quickly ask about examiner, can I appreciate a heart sound audible? Is there any murmur, any added sound? Okay. So in here, yes, heart sound dual audible, but we can appreciate there is a pansystolic murmur. So you can ask like, can I appreciate that murmur radiates to the axilla or not? Or like characteristics of the murmur, any crackles. Okay, so respiratory examination, ER entry bilaterally equal, any wheeze, any crackles. So here bibasal crackles positive, and also like to rule out heart failure, you should also ask about any pedal edema, but you can ask later on. So abdomen examination here, positive findings is there is hepatomegaly, splenomegaly, and size already given 2 centimeter below left costal margin. Left lower limb, yes, there is a pitting pedal edema, positive. You can ask about office test, that is urine dipstick test and blood sugar level. Sometimes you can ask ECG, because those all are the office test. Okay, you might get positive findings or you may not. Now coming to the diagnosis and differential, because your task was diagnosis and differential management, not your task. So here, based on the history, most likely I am thinking you are having a condition, we call it infective endocarditis, causing secondary to heart failure. Why it happened? When infection causing bug enter into the blood, and that goes to your inner lining of the heart, and that can cause infection around your heart or heart muscle. Okay, and why this happened? I am thinking because of sharing needles, and it might be the source of the infection. Okay, and that infection actually affected one of the valves in your heart. That's why I heard murmur or abnormal heart sound. Okay, so it's a failing to pump out blood. And I also notice you are having short of breath, leg swelling, so that leading to like heart failure. Okay, that infection leading to heart failure. Other possibilities, it might be hepatitis B, C due to needle sharing, hepatitis B, C, D, or HIV, or any travel-related infection like dengue, malaria, typhoid, or any STI-related infection. Other problem, it could be cholecystitis, like inflammation of the gallbladder, cholangitis, inflammation of the bile duct, cirrhosis of the liver, like damage of the liver tissue, that can happen. Okay, and as I mentioned, like it could be due to hepatitis as well. Um, but we need to also rule out HIV because of the seroconversion, because your patient mentioned like 2 weeks ago, patient had flu-like illness. So it might be due to seroconversion reaction. So you need to rule out with that. With your patient consent, you have to do all the screening. But management, not your task. Your task is just mention about possible diagnosis and all other differential. Okay. Try to give differential, relevant differential as much as you can. Okay, and finish with 8 minutes. Time definitely in here, key point. If you took a very good history physical examination, but you can't reach a diagnostic differential, time already finished, so you can't pass this case. Okay. Any questions for this case? So for this case, and also not for this case, as I mentioned, like when you notice patient gives you very vague symptoms, or patient is coming with acute infection, you are not sure about what could be the differential, please follow that PUMA format. At least you should cover breast, cardio, abdomen, or like urogenital system, so that you might get something positive. Okay. For tiredness, there is other like mnemonic for tiredness cluster. Please follow that one. But in here, patient actually not sure either patient is feeling tired or feeling lethargic or feeling unwell. That's why I would suggest follow that one. Yes, definitely. You can ask like um, whatever your patient name, Jack, John, whatever. Like, hi John. Yeah, I'll be one of your doctor in here in this GP practice. John, whatever we are going to discuss, it remain confidential. Is that okay if I'm going to ask you a few more questions so that I can know what exactly going on? From the note, I can see that you just came from the trip, and in the trip you used heroin. In this way, like you can start your conversation. Is it possible to ask all those questions within 6 minutes? Definitely is possible. That's why in MC Clinical, there is no alternative apart from role play. You should role play as much as you can. Okay. You can start tiredness question, but as I mentioned, like it depends on of your history of presenting complaint. If your patient mentioned, yes, doctor, I'm feeling tired, start with tiredness question. If you mention like history of presenting complaint different, so start that one. So in this case, critical error would be approach. In approach wise, you should give confidentiality and ask about details, infection related questions. You should ask about chest infection, heart infection, abdomen infection as well. If you are missing in history that infection related question, it would be critical error. Um, Physical examination point, critical error, it would be you need to ask about um, abdominal finding, cardiovascular finding, and differential diagnosis. You need to cover all the um, like heroin related infection. For any clue is going towards infective endocarditis. For that, as I mentioned, like patient coming with acute infection, and also like there is a positive history of fever, chest pain, palpitation, and also patient having short of breath, pedal edema, patient feeling like constitutional feature as well. And there is a source of infection. If you are taking details physical examination, you might get hard findings. Okay. For tiredness, should we follow Puma or Hemifedo? Dr. Maria, as I mentioned, like for tiredness cluster, there is a different mnemonic. You need to follow that one. But for Puma, like if you got vague symptoms, a patient is not sure about how he feels, you need to follow that time. You can follow Hemifedo, but if you are going to follow Hemifedo, it will take a long time. Uh, for diagnosis differential, yes, when you are going to talk regarding diagnosis differential, you need to explain why you are thinking, because like you are thinking it could be due to infective endocarditis, inflammation of the lung covering. That's why you are thinking like that, you need to explain. Okay, let's move to the next one. Who wants to perform next one? Um, okay, Dr. Pabuda, are you there?
Yes.
Okay, so let's start.
Okay.
This is your case and your 2 minutes starts now.
Okay. So is the observation chart available here?
I'll tell you the observation.
Okay. Okay, I will start.
I'll tell you when you need to start. Toxicity and neurotoxicity. You can start.
Okay.
Okay.
Hello, good afternoon. I'm Dr. Paboda, one of the doctors in the hospital. I understand that you came here after an accident, so don't worry. Now you are in safe hands, and I understand that you have been seen by the initial surgical team, and your vitals were okay. But I understood that you have pain again. So could you tell me how much pain you have at the moment? Out of, if 10 is the worst and 0 is the least?
Yes, doctor, it's so much painful.
Okay.
It's almost like doctor 6 to 7.
Okay. Do you have any allergies to medication?
No, doctor.
Okay, so I will give you some painkillers now. So before I go into further details, I would like to know your vital signs. Is that okay if I go and ask them?
Yes.
Okay, thank you. May I know the dear examiner, may I know the vital signs of my patients, including the pulse rate, blood pressure, respiratory rate, and saturation? and
You can
temperature?
proceed. Your patient obs are stable at this moment.
Okay, thank you very much. So could you tell me more, where exactly is the pain?
In my upper tummy, doctor, but I feel pain on all over my tummy.
Okay. Does it go anywhere else?
Uh,
Did it-
no, doctor.
Okay. Do you feel dizzy, any shortness of breathing?
No,
Okay. Any chest pain?
no.
Okay. So what is this type of your pain? Is it like tightening pain or is it a sharp pain?
It's dull generalized pain, doctor.
Okay. So is it a constant pain or is it coming and going?
It's coming and going.
Okay. Does anything make it worse or does anything make it better?
I think painkiller just helps me a bit.
Mm-hmm. Okay. All right. So what I understand is that so you had this accident and we have done a CT scan of your tummy. So that shows multiple rib fractures. So that is many of your ribs have only your left side has broken. And so it has ended in some injury to your spleen. So spleen is one of the organs in the left side of your tummy. Oh, so that's why you are getting this left side tummy pain. Do you understand me?
Yes, doctor.
Okay. So as your vital signs all stable, so we decided to manage you conservatively. That means we are observing your vital signs and see how it goes. Because as there is an injury to your spleen, it can lead to some internal bleeding. Um, so there can be some other injuries in the internal organs as well, but the CT didn't reveal any other organ damage. Are you with me so far?
Yes, doctor.
Okay. So, but as you mentioned, so you have increase in pain. So I would like to observe you, and also I would like to do some blood investigations. So I will put a IV cannula to you and take some basic bloods, including full blood count, CRP, liver functions, kidney function test, and blood group and hold. And I will start, if your blood pressure low, I will start you on IV fluids, normal salines. And I will inform my senior to come and have a look. I will inform the surgical registrar as well, because you may need to undergo surgery if your condition get worse in the future. Are you with me so far?
What do you mean by surgery, doctor?
So
Is
because
everything okay?
because you had this injury to your spleen, so it can cause. So we are observing at the moment to see your vitals. At the moment it's stable, but if it become unstable, so we may need to remove your spleen by a surgery. Do you understand me?
Okay. Is it a big
So
operation, doctor?
it's we
You
have to you have to do it with under the general anesthesia. So that is you will given general anesthesia, so you don't have any consciousness, so you don't know. So this organ is important for your immunity. But if it is that if we can't conserve your spleen, if it is started bleeding, it's life threatening. So it's in that case, it is safer to remove the spleen rather than keeping. So we do the risk assessment, and we see whether the risk can benefit, and if it is necessary, so it may need to be removed. So in that case, if we remove this spleen, so that will be decided by the senior doctor, the surgical team. So if they decided to do that, so there are risk of infections. So I would give you advice about that as well. So we have to give you some regular vaccinations like pneumococcal vaccines, and we have to monitor your blood counts because there's a risk of blood clotting after the spleen removal. And also there's like surgical complications like infection, bleeding are always there. But you don't worry, because you will be undertaken by a multidisciplinary team. So all of them are like a very skilled and experienced team. So you will be in safe hands. Okay.
okay?
Okay. So at the moment, so we have not decided. So you will be seen by the senior doctor and they will decide. So until that, I will chase those bloods we send and prepare this for surgery if necessary. So don't take anything from mouth. Keep your, don't take anything, eat or drink. So we will observe your vital signs and see. I know this is not what you expect. So, but we are doing the best management for your
Your time, doctor.
consideration. Okay.
Okay. So I forget your name. Sorry, it's Paboda. Yeah, it was nice performance, doctor. Yeah. In this type of case, you need to ask about vital stability in the beginning, which you did. That was nice. And offer painkiller, offer strong painkiller after ruling out allergies. You also did that one. What I noticed, because it's fully counseling session, you need to like involve your patient and show a little bit empathy to your patient, because you are suspecting there is a spleen laceration and you are going to remove spleen. So I feel like you can just involve your patient a bit and show your empathy to your patient. Like you can say like. I know it's a difficult situation for you, but we all are here to help you, and we are going to take you in the theater. You already explained about, yes, there is like experienced surgical team will be there. There is a risk of surgical risk like infection, bleeding, anesthesia, but during the operation or if any complication happened, we all will look after you. Another thing is that what I want to tell you, IV drip already running. And you can reassure your patient that at this moment you are vitally stable. Okay, so we are going to treat you conservatively, but splenectomy and the management, you need to mention details. You mentioned about the splenectomy, you mentioned about the infection bleeding risk, that was okay, but I feel like, did you mention about the long-term management? If we are going to remove spleen, you need to be vaccinated frequently.
Yeah, pneumococcal vaccine I told, and then the risk of DVT also told.
Okay, nice. Okay, so let's discuss the case.
Thank you.
No worries. So 30 years old female met with an accident. Another car crashed into her car from side and patient was retrieved, brought to the emergency department, primary survey already done, reviewed by surgical team. CT abdo found that there are multiple rib fracture on left side and also there is a spleen laceration. Decided to manage conservatively at this moment, but 3 hours later on, patient complained of increasing pain and you are asked to review the patient. So observation chart already given inside the room and patient lying on the bed with a drip running. So your task is explain the differential or explain the condition to the patient and management in here. So in this case, please check vital stability. First, you have to check either your patient is hemodynamically stable or not. If you notice your patient is not vitally stable, you need to follow DRA-ABC protocol. Okay, but in here, your patient is vitally stable, so you can proceed to the next step. Now, in case you notice your patient blood pressure dropping, heart rate increasing, that time, as I mentioned, like any vital instability, you need to follow DRABC protocol. So you can mention, I would like to make sure either is there any cannula in the arm or not. If no cannula, I need to insert IV cannula, take blood sample for routine blood investigation, and I'm going to start fluid. But here patient already on fluid and also patient is on connecting with the monitor. So you need to inform current situation to your patient. So you can mention, hi Janice, I am Dr. X, one of the doctor looking after you. So I can see that you have had a road traffic accident. I'm so sorry to hear about that. Are you having any pain at this moment? Yes, your patient is having pain. So you can mention, after ruling out any allergies, I can give you more pain medication. Okay. So Janice, reassuring thing at this moment, I looked on your observation chart and your observation looks normal if your patient is vitally stable. If you notice your patient hemodynamically unstable, you can explain to your patient as well. If you notice BP is dropping, heart rate increasing, you can mention in this way. Okay. If BP is dropping and heart rate increasing, so I'm concerned a bit about it. So it indicates that you might lose some blood internally. Okay, so good thing is that we have already attached IV cannula to blood sample for investigation. Drip is running, and I already informed my register to come and have a look. Okay, let me assure you that you are in safe and we'll try our best to give you the best possible care. Please reassure your patient. Here your approach reassurance matters a lot. Okay, because it's fully counseling case and predominant assessment area is counseling, so you will be marked on your approach. So talk about causes of bleeding. So bleeding could be from anywhere in the body. It could be injury to the lung, spleen, or any other body organ or the vessel. But you have had an accident and we have done a CT scan of your chest, neck, that were clear. But we have done a scan of your tummy and we can see there is some injury to your spleen, which I'm suspecting the most likely cause of the bleeding. Okay. So explain the management and you can mention like spleen what is the spleen, because your patient is non-medical person, so you can mention like spleen is just located in the left side of our tummy and it is part of our immune system. It has like multiple roles. You can explain like it can filter blood and also helps fighting against the infection. Okay, but it is very prone to injury during any blunt or penetrating trauma. Okay, so at this moment, we usually keep you on observation. There is a chance of bleed to stop by itself, but in case the bleeding reoccur and make your condition unstable, that time I need to inform surgical registrar who will take you to the theater immediately to remove that spleen. We call this procedure name is splenectomy. Okay, they might decide to do some imaging as well. So what happened? Talk about splenectomy because management is your task. So if we decide to do splenectomy, surgery will be done either keyhole or the open, and definitely it is performed under general anesthesia by experienced surgical staff. So you will not feel any pain. You will be putting under sleep. Okay. Like every other surgery, there could be complication like infection, bleeding, injury to the other structure, risk of anesthesia, but this will be done by a very experienced staff, so complication will be unlikely. Long-term management, please mention long-term management as well. So body can live without spleen, but it helps to fight the infection. So when you will not have spleen, there is high chance of catching infection. So for that reason, we'll give you vaccine very frequent basis, like pneumococcal vaccine, influenza, hip vaccine as well. Okay, other complications like clotting issue you can explain, and you will stay in hospital, and we are going to give you advice regarding the specialist decision like that. Okay, and follow with the 4R. So this is the case of splenectomy, spleen injury and splenectomy counseling case. If you notice there is multiple reef fracture, so basically for the reef fracture, we are doing conservative management. In case of pain, we can just give analgesia, pain medication, or any like, Voltaren gel on that area to relieve for the pain in this way. For reef fracture, we are just observing either any developing any pneumothorax or not. So just mentioning these things. In this case, we don't need to ask history because history not your task. For DRAVC protocol, how do you elaborate? If your patient is unstable, you can mention like, doctor, I'm going to follow DRAVC protocol. So I'm going to start, I will check airway, breathing, circulation. You can mention. For online exam, you need to ask, how do you show that we are assessing if the patient is stable? Look, for online exam, STEM vital sign will be given. In the STEM vital sign will be given. If vital sign not given, you can mention like, I would like to start my case, or I would like to check your vital sign first, and then I'm going to explain your condition. So it also covered. Okay. Do you need to do repeat CT? Repeat CT or whatever, it will be decided by your registrar or like consultant. So always remember, AMC clinical is a junior level exam. It's not a specialist exam. So whatever you are going to take decision, it will come from your registrar or from your consultant. So if your patient might need repeat CT, you can mention like, if any further imaging needed, I'll let you know. and based on the surgical register decision. That's why I mentioned like I'm going to call my surgical register to come and have a look. Look, pain could be from ribs or pain could be from the tummy. But when Dr. Paboda asks me, where do you feel pain? Most of the time I mention I feel pain from my tummy. Okay. So as I mentioned, if pre-fracture pain, if there is no short of breath, no cough, no sign of pneumothorax or nothing, we are just doing conservative management for refracture. But we are concerned about any internal bleeding for tummy pain. And if vitals, if your patient vitals unstable, definitely we need to be worried about it. Can't we include ultrasonography as she is complaining of pain 3 hours later? You can do like imaging as much as you want, but the thing is that CT abdo already done, okay? If you are suspecting about any fluid or anything, you can do ultrasonography, but ultrasonography sometimes they can't assess, so they further advise to do CT abdo, so it's already done. Yes, differential would be there is other organ injury, as I mentioned, injury to your stomach, injury to your liver, or injury to your gut. There is no task for history. So if you want, you can ask his history in between when you are going to explain your patient differential diagnosis. But if you are asking in a history pattern way, how we did in our first case, it's not like the case. Okay. So we have to explain differential to the patient, or do we need to mention and explain pneumothorax? Okay, in here, follow the task. Okay, I know there are like lots of new candidate in here. So for that reason, I would suggest you need to follow theory course because I'm not going to discuss with you the structure. For this particular case, when your task is explain diagnosis differential to the patient management, you need to follow that one. For this case, you don't need to take history, you don't need to take physical examination finding from examiner. History and finding will be given on the stem. Yeah, you should stick to your task, definitely, because um, your task is you need to talk with your patient regarding explain the diagnosis and management. There is no point of talking to your examiner. If you are a face-to-face candidate, you can ask your examiner when you are starting your case, examiner, may I know my patient vital sign? So that time you can communicate. Otherwise, like this case, basically you need to communicate with your patient. Okay, if you are asking history to your patient, which is not your task, examiner for face-to-face exam, examiner will tell you stick to your task. Okay, that means they're a bit angry or they're not happy with your performance because you don't understand what is the task in here. For online exam, nobody is there, like no examiner is there, so definitely no one will tell you like stick to your task. So you can ask history, physical examination, whatever you want, but your time will go. Definitely you can't finish with time. Yes, it's possible to make a most probable diagnosis and differential based on the history, based on the physical examination finding, which is given on the stem. As I mentioned, history and physical examination finding will be given on the stem. Okay. Okay, so let's move to the next case. Um, I think many candidate already mentioned about their name earlier. I forget their name. Hmm. Yeah, Dr. May Alwas. Hello, can you hear me? Hello. Hello, doctor, can you hear me? Mm. Okay, Dr. May Alwas, I can't hear you. Okay, that's fine then. So move to the next candidate. Who will be the next? Okay, Dr. Iman. Iman, this, sorry. Dr. Iman, you want to perform?
Yeah. Yeah.
Okay, that's fine. So this is your case and your 2 minute starts now.
Okay.
You can start.
Okay, thank you. Hello, dear. This is Dr. Iman, one of treating physician here at the clinic. What should I call you?
Hi, doctor. I'm Alan.
Alan, and your son name?
Oh, my son name is Alan, and I'm Rachel.
Okay. Hi, how are you? I hope you're fine. Okay, today I just want to ask you some question. I see here in your notes that you are here because your son school performance deteriorated this last 6 months. Am I right?
Yes, doctor, I'm concerned about my son's school performance. I don't know what's wrong with him, but I got a letter from his school and they mentioned that his school performance has significantly deteriorated.
I see. Okay, I'm sorry to hear that. Actually, I know you are worried about your son. First, I want to make sure that you know that everything will say here will be between you and me. No one else will know what we are talking right now. Is that okay?
Okay.
Okay. First, I will start with you, Richard. Can you please tell me anything you are thinking that the child has that make them has this worsening or deterioration in his performance these days?
I don't know, doctor, because Alan didn't tell me anything.
So you asked him before and he did not tell you.
Mm,
Okay. So can you please let me talk to him?
okay,
Yeah. Hi, Ellen. How are you?
I'm okay.
Fine. Can you please tell me what happened with you in the school? Anything making you did not like the school or did not like to study or someone just um, bothering you at in the school?
No, I'm okay.
You are okay. Okay. Do you think you have support at home or at school?
Everything is okay.
Okay, Alan, if you want to talk alone in the room, we can talk alone. We'll take permission from your mom to leave us at the room. Is
Okay.
that right? Okay. Uh, can you please let me talk with your son alone?
Yes,
Then I
sure.
will. Thank you so much. Okay, Alan. Would you please tell me now what you are feeling? Anything bothering you?
Yes, doctor, actually last 6 months, actually I can't concentrate on my studies.
Uh-huh. Why? Why you cannot concentrate? Did you think about anything? Did you feel anything bad?
No,
Mm-hmm.
I feel like I'm a bad person.
Oh, I'm sorry for that. Would you please tell me more about that? Why you are feeling this thing?
Actually, doctor, I like a boy in my class.
You like, sorry?
I like a boy in my class.
Uh-huh. Okay. Um, okay. Um, 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 okay. Do you have any do you think do you have any change on your sleep or appetite?
Appetite is okay, doctor. Sleep is also okay.
Is also okay. Okay, do you feel sad? anytime at home or school?
Yeah, doctor, I feel sad. I feel I'm a bad person. As I mentioned, I'm like a boy. I shouldn't do that.
Okay. Do you feel like you cannot enjoy by anything that was previously making you happy?
Yeah, sometimes.
Okay. Anyone point to you in the school or talking about you?
No,
No. Okay. Did you see or feel or hearing sounds that others don't?
no, doctor.
Okay, great. I would like to ask you some question. Could be strange for you, but just screening question, okay?
Okay.
Do you think to harm yourself?
No,
Okay. Um, um, okay, are you thinking you want to harm others?
what's that?
You want to harm others or something?
No,
Okay. Do you feel guilty?
sometimes I feel guilty.
Okay. Did you have any episodic you are very happy in at home or the school?
No,
Mm-hmm. Did you think you have some special power?
no,
Okay. Um, did you think you need some help
yes, doctor, I think so.
regarding what?
Regarding,
Your sadness and so on?
yeah,
Okay, great. You know who I am?
you're my GP.
Okay, great. Where are you right now?
I'm at your clinic.
Okay, great. Do you have any medical illness?
Your time's up.
Okay.
Okay, Dr. Ridman. Your approach is really nice for psychiatric patient, but the thing is that time management.
Yeah.
Okay, so what do you think? What the case? What do you think? What is the case?
I think he has maybe mild depression.
Mm-hmm.
Not sure.
Okay. Did you hear what I told you? Like, I told you, like, doctor, I like a boy.
Yes.
Hear that? Okay. And your patient is sad about it. Your patient is depressed about it. So you should ask about details related this because your patient is also boy and he likes a boy and he feels guilty about it. Okay.
Mm-hmm.
So it's
Mm-hmm.
yeah, it might be underlying depression, but it's a gender dysphoria case.
Uh-huh.
Okay.
Okay.
So I'll discuss with you. Otherwise, your approach was really nice, and I was really happy that you asked mom because you want to talk privately with your patient. That's really nice. Okay, and actually, if you could finish with time, I would say you will pass definitely this case if you could finish with time because how you like talk with your patient, how you manage, like that was really nice. Okay. So let's discuss the case. You are a GP and a mother brings her 15 years old son claiming that her son's school performance has deteriorated from bad to worse for the last 6 months. So task is further focus history from the mother or the patient and counsel the patient about the diagnosis and management. Again, another very vague history, school performance deterioration. So we are not sure why these things happen. It might be due to organic cause or it might be due to any psychological issue. Okay. But in back of our mind, we have to think definitely we need to rule out psychiatric causes as well. Okay. patient is 15 years old. And also when you are asking about detailed psychosocial history, please make sure you are giving confidentiality statement, okay? So here, open-ended question about school performance. You can ask about school performance to the mom, or you can ask school performance to your patient, okay? And think about school performance, slow school performance causes. As I mentioned, it might be any behavioral problem or it might be any organic cause, okay? But please, you need to make sure if your patient, if he didn't open up, you can offer her, can I speak with you privately? Or like you can ask mom, like, would you want mom to be here, or do you want mom to wait outside so that we can finish our chat in this way? It is very key point in this case, okay? Because when mom went to outside, then patient he opened up actually. So the issue is here, he likes a boy, okay, and he thought that it's a bad thing, and that makes him like sad, feeling depressed, and school performance deteriorated about that. So you need to rule out any transsexualism. So you should ask, like, do you feel that like girl's body entrapped in your boy's body? Or you can ask, like, by any chance, did you notice, did you dress up like a girl and you get sexual pleasure? Like, ask about all the gender identity disorder related questions. Okay. Do you have any sexual fantasies? Have you spoken to that guy? How do you feel? Like, you should ask clearly, do you just only like that boy, or do you feel sexually attracted? Okay. If patient feels sexually attracted, that means it's a homosexualism. If patient just like, so it could be like just normal. Okay. So based on that, according, it's a history of presenting complaint and differential. Please ask about psychosocial history as well. So for the psychosocial history, you should ask about how Dr. Iman asked me about mood, sleep, appetite, also any suicidal idea, any hallucination, any delusional question very quickly. But like, because time is very limited and your task is also counseling regarding that, you can skip about orientation, time, place, person, asking those questions. Because to be honest, the main thing is here history of presenting complex differential and just the psychosocial history very quick. Okay. You can skip cognition inside those things. But if you notice patient has severe like depression, patient has like definitive suicidal idea, that time you can ask about insight adjustment. Okay. So in here, counseling, your patient is concerned, doctor, am I gay or not? Because he likes boy. So you can say a lot of people they like same sex because we have already done like study shows that there are like young people face same sex attraction, sexual and romantic relationship between people of the same sex can happen, and they are known in every culture and society. Okay, so I can see that you are going through a very rough phase. You are concerned about it, uh, while you are trying to work out your sexual identity. It's not an uncommon condition. Okay, so just reassure your patient it's not an uncommon condition. It's very common. Okay, it doesn't necessarily mean that you are gay because people often experiment with their sexuality. Okay, and another thing, please be remembered that being a gay is a normal sexual identity. Okay, and there is nothing wrong or abnormal about it. Uh, so I know that because patient is also concerned about his parents, because he thought that his parents are not going to take it well. Definitely. So he's concerned about it. But you can mention like, look, I can understand your concern, but your parents are there to support you and help you. Okay. So if you want, I can discuss or I can arrange a family meeting, or I can refer you to the Family Planning Victoria, and they have the specialty with sexuality and reproductive health. They can give you further information about safe sexual practice, help with psychological support going through that hard phase of your life. Okay, so you can discuss in this way with your patient. So basically, a case coming in clinical, 27 years old Alan has been referred by his psychologist because of gender dysphoria. He is actually Alexandria, but he prefers to call his name as Alan, and he prefers to address to him as a he, not she. Okay. There is some gender dysphoria, gender identity disorder classification. You can have a look. So regarding gender dysphoria, you can explain to your patient that gender dysphoria is an inconsistency between one's biological sex and gender identity, and that can cause significant distress. That can cause significant distress to that person. Okay, but nowadays gender dysphoria displaced with or replaced with gender identity disorder, and that gender identity disorder is a very big umbrella pattern. Okay, people often with gender dysphoria manifest can happen at different developmental stages, but they are not they are concerned about their sexual identity, or they are presenting with a depressive feature as well. Okay, but the prognosis of gender dysphoria is generally positive and improves with treatment. Sometimes need combined therapy like psychotherapy, hormonal therapy, and last resort is a surgery. But as I mentioned, like very few people who choose surgical genital reassignment have regret later stage of their life for their decision. That's why we always often to give them advice regarding combined therapy, psychotherapy, hormonal therapy, like that. Okay. For gender identity disorder or gender dysphoria case, any patient coming to you, you need to take a proper history and definitely maintain confidentiality statement. But they are often like uncomfortable with the physical examination. So at first physical examination, you need to avoid that one. But clinical feature, they might present with you significant difference between their own experience gender and their secondary sexual characteristics, a strong desire to be rid of their secondary sexual character, and wanting secondary sexual characteristics of the opposite gender. Okay, and also they are wanting to be treated as the other gender. Risk and support assessment, they are having risk of developing depression, suicidal idea, mental health issue, those things. That's why when you are taking history, make sure you are asking detailed psychosocial history. Okay. But Medicaid treatment, as I mentioned, psychotherapy, combined hormonal treatment as well. Examination, please try to avoid examination at first visit. And there is some differential. If your patient, if you are suspecting it's a gender dysphoria or gender identity disorder case, what could be the other differential of this case? It might be transvestic disorder. It might be body dysmorphic disorder. Please make sure you are asking about, are you worried about any parts of your body that is coming again and again and you are preoccupied of it? Okay. Any psychotic disorder along with that, like any schizophrenia or other things, mania, you should ask. Borderline personality disorder, it could be one of other differential. So you need to rule out those things. Okay. Investigation, just baseline. We are not going to do any other investigation, just the basic baseline investigation and management, as I mentioned, hormone therapy, combined psychotherapy, but surgical reassignment therapy would be the last resort. And please mention that we are going to treat your case as a multidisciplinary team. Okay. For organic causes, you need to rule out any infection, any thyroid-related issue. So infection, you can quickly ask about any fever, any flu-like illness recently, thyroid issue, any weather preference recently, any cancer or any tumor, and also you should ask about any injury. Okay. We are not going to start treatment for this patient at this moment. We are just counseling that patient. Okay. So you don't need to worry about consent at this stage. And you need to focus on your task. Okay. So who will be the next one? Okay. Who wants to do role play? Dr. Christian Maduka, are you there?
Yes, I am.
Hi. Okay. So this is your case and your 2-minute starts now.
Okay.
Okay, you can start.
All right. Hello, Thomas. My name is Dr. Christian. I'm a GP in this facility, and I'll be attending to you today. It's nice to meet you. I can see from your notes that you've been having some complaints of excessive thirst and increased urination. How are you? How are you feeling today?
I'm okay, doctor, but I don't know what's wrong with me. I'm feeling really like thirsty all the time.
Okay, I understand, Thomas. I can imagine how this can make you worry. But I want to reassure you, I want to assure you that I'm going to do my best to figure out what is wrong with you so that I can treat you appropriately. Okay?
Okay.
Yeah, so Thomas, I would like to ask you some questions to guide me in determining what is wrong with you. And I want to assure you that everything we talk about will be between both of us. Is that okay?
Yeah.
All right. So for how long have you been having these symptoms, Thomas?
For a few weeks, doctor.
Few weeks. Okay. Could you tell me more about them?
As I mentioned, doctor, all the time I'm feeling thirsty. I'm drinking a lot of water, but I'm feeling thirsty all the time.
Okay. I can see that you're also having excessive urination.
Yeah,
Okay. How many times do you wake up at night to urinate?
maybe 3 or 4.
And is that different from the usual? Is that more than the usual?
I think so. Maybe, doctor, I'm drinking lots of water. That's why I need to urinate more. What do you think?
Yeah, I understand why you think that that's the case. However, it's important that I determine if there are other possible causes for the excessive urination and the excessive intake of water. Okay?
Mm-hmm.
So I just want to know, do you have any other symptoms, any fever or abdominal pain?
No,
Okay. Do you have any muscle weakness? Do you feel weak all the time or at any point in time?
no,
Okay. Do you have any issues with your vision? Do you have any impairment in your vision?
no,
Okay. Have you noticed any abnormal sensations in your hands and legs, feeling of needles or abnormal hotness in your hands and legs?
no,
Okay. Um, have you noticed any weight loss or weight gain in recent times?
no, doctor.
Okay. Would you say that the symptoms are there every day or it just comes and goes?
Most of the time.
Okay. Um, have you had uh, have you had similar experiences in the past?
No,
Okay. Would you have any neck swelling?
no,
Okay. Do you feel excessively hot when others are cold, or do you feel excessively cold when others are hot?
no,
Okay. Do you have any joint pains or weakness in your joints?
no, doctor.
Okay. Do you have any long bone pains?
No,
Okay. Do you have any medical condition you'd like to let me know about? Diabetes, hypertension?
no, doctor.
Okay. Would you say your general health has been fine before the onset of this illness?
Yeah, I'm pretty healthy.
Okay. Um, would you say that you have any family history of diabetes or hypertension?
My mom has diabetes, no hypertension.
Okay. Have you been tested? Have you had any tests done on you in recent times or any time in the past for that, for diabetes?
I think so.
Okay. What was the outcome?
Everything was
Can you
normal.
remember? Okay. Do you smoke? Do you take alcohol?
Uh, I don't smoke, but drink alcohol in the weekend.
Okay. Are you taking any recreational drugs?
No,
Okay. Are you taking any medications for anything?
no,
Okay. Do you have any known allergies you
no.
want to talk about? Okay. I can see that you're a PhD student. Has there been any stress at school, in school recently, or any change in your social activities recently?
Oh, doctor, as a PhD student, it's always like it's a very stressful job. Yeah,
Oh, okay. Um, how about your feeding, appetite? Any problem with your appetite? Do you have any decline in appetite, vomiting, or diarrhea?
no,
Do you have any difficulty breathing, chest pain, or cough, or
no,
palpitation? Okay. Do you have any yellowish discoloration of your eye, abdominal pain, or swelling?
no, doctor.
Okay. Do you have any ear pain or discharge, any eye pain or discharge?
No,
Okay. Are you having any change in your any difficulty urinating, painful urination, or discharge from your private parts?
no, doctor.
Okay. Thank you so much, Thomas. You've been very helpful. With the history you've given to me and all that you've shared with me so far, there are a few conditions that could possibly give the symptoms you're having. One of them is diabetes mellitus, particularly type 1 diabetes mellitus, because of your age and the symptoms, the excessive urination, excessive thirst and urination. Also of consideration is hypocalcemia, a condition where you have low calcium in your blood. Could be due to decreased vitamin B in your system. Vitamin B, the vitamin responsible for regulation of calcium. It could also be due to increased loss by your kidneys. But when you have this hypocalcemia, decreased calcium in your body, it could result in increased thirst, and that could also result in excessive water intake and increased urination. Also, if you have diabetes insipidus, where you have excessive loss of urine, water from your body, it could also make you to have increased thirst and the particular symptoms you're having. Okay, the weather as well could also predispose you to having increased loss of urine, water in form of urine. However, that may not cause increased thirst. Okay. However, at this point,
Your hands
okay. Thank
Okay.
you.
Yeah, doctor, it was really fantastic performance. Most of the thing you covered, actually history, you didn't miss anything. But the issue is you mentioned about diabetes mellitus. It could be one of the reason. Your differential was fantastic, but in here it's actually hypercalcemia case. How? You asked me about everything, all the hypercalcemia related question, all are negative, but you also asked me about are you taking any medication? So if you are asking me in this way, um, as a clinical, and I noticed like on the past as well, like Roleplay didn't give you any exact answer. You should ask, are you taking any over-the-counter medication? If you ask me, that time I would give you, yes, doctor, I'm worried about vitamin D, low vitamin D level, and I'm taking excessive vitamin D and calcium tablet from the over-the-counter. Okay.
Okay.
Yeah, so
Okay.
the history, that part is missing, and that actually leads to hypercalcemia. Suspecting hypercalcemia, diabetes mellitus could be one of your second differential. Okay, so let's discuss the
Okay.
case so that you can understand. Otherwise, your history, you have very nice structure. Your differential was actually nice. You give me nice differential. Okay, so just keep it up.
Okay.
Okay.
Thank you.
Okay, so let's discuss the case. You are a GP, you are going to see a 27 years old Thomas, PhD student, coming to see you because he thinks he is excessively thirsty these days and also increased urination. So your task is take a history differential diagnosis. Very clear-cut case. You have to take a history differential diagnosis. That means you need to take full 6-minute history and explain differential within 2 minutes. Okay. So definitely introduce yourself nicely, then ask about history of presenting complaint. Here, patient presenting complaint is excessive thirst. So ask about details. How long do you feel that? How much do you drink per day? What do you drink basically? Are you drinking plain water or are you drinking like any sugary or frizzy drinks like that. Okay. Does it continue even after you drink as well? Like you feel thirst even you are taking more drink, and anything makes it worse, anything makes it better? Did you notice any relation with with any particular weather? You should ask. Also, patient complaining about polyuria, so you should ask about how many times. What about night time? How many times you need to wake up from bed? Any changes in urine, like any color changes, any smell? You should ask about any infection, any fever, any pain during passing urine. Okay. So coming to the causes of excessive thirst or your differential. Your first differential, you need to think about diabetes mellitus. So do you have any symptoms like tiredness, extreme hunger, or blurring of vision, or any on you notice that is slowly healing, any skin infection? How about diabetes insipidus? That is, you should ask about any head injury recently, any previous surgery, any headache, nausea, vomiting, those things. Dehydration question, any recent diarrhea, vomiting, any profuse sweating, any strenuous exercise you are doing, you should ask. Then any loss of body fluid into tissue, like you should ask about any recent infection, any heart related problem, liver, kidney related problem, any recent injury or burn, any psychogenic cause, because especially as a PhD student, it might be like mental stress or adjustment disorder like that. You should ask about any mental illness, psychosocial history details. Okay. Any medication are you taking? If you are asking about your patient, MC clinical is a bit tricky. I know they shouldn't do it, but they are frequently, if you are asking about, are you taking any medication? Most of the time they mention, no, doctor, I'm not taking any medication. But you should ask specifically, are you taking any antibiotic, any steroid, or any over-the-counter medication? Yes, your key point is he's taking supplement, that is vitamin D and calcium, and he is very concerned about low vitamin D level. That's why he is taking 3 to 4 tablets per day. Okay. As I mentioned, like you should ask how many tablets you are taking per day, and do you eat a lot of spice or salty food like that. Okay. For hypercalcemia, you should ask about constipation, any tummy pain, a headache, muscle cramps, weakness, any disturbance in the thinking process. You should ask past medical surgical history, family history of any diabetes, SADMA. Okay. So here condition, there are many causes that can lead to increased thirst and increased urination, but I'm suspecting most likely cause in here is hypercalcemia. Okay. What's that? It's a increased calcium level in the blood, and you gave me the history of excessive vitamin D calcium intake. That is too much calcium in the blood means that your kidney have to work harder. Okay, and that's why you are having increased urination and you are feeling thirsty. Other cause could be diabetes mellitus, which is increased sugar level in your body. That can lead to increased sweating, excessive hunger, or um, feeling tired like that. Okay, diabetes insipidus could be another reason, but that time, like patient may present with different symptoms, and that usually happen after any recent surgery or trauma. Okay, or other reason could be excessive spicy, salty food intake, or any hormonal imbalance in our body. Okay, so in this way you can explain. Yeah, it could be psychogenic polydipsia. You can put it as a differential. It's nice differential, psychogenic polydipsia. Okay. Okay, so let's move to the next case. Who wants to perform next case? Anyone wants to perform? Okay, Dr. Aki. Dr. Aki, can you hear me?
Yes, I can hear you.
Hi.
Hi.
Sorry. Okay, this is your case and your 2-minute starts now. You want to start? Dr.
Yes.
Aki, you want to start? Okay, let's start.
Hi, Mary. I'm Dr. Aki, your GP today. How are you doing?
Hi, doctor. I'm okay, doctor. I want to know about my scan report. Is everything all right?
Yes, I got your report. I will explain this thing to you, but before that, I want to ask you more question, like how you are doing right now. Do you have any discomfort at the moment?
No.
Okay. From my notes, I can see you are 20 weeks pregnant.
Yeah.
Okay. Any pain, any shortness of breath, any concern regarding the fetal movement?
No, doctor.
Okay. And do you know what this ultrasound was done?
They're just checking about my baby's condition, isn't it?
Yeah. Okay. So it was just a routine checkup?
Yeah.
Okay. Was this a planned pregnancy?
Yes.
Okay, congratulations. And actually, it's good news. You are having two baby. It's a twin pregnancy.
Really?
Yeah. Yeah. So from your ultrasound report, I can see that it's a twin pregnancy, and also the good thing is both of your baby has separate like separate amnion and chorion. Like I can draw a picture for you. Like sometimes both baby can share only one amnion and chorion, like they can have only one sac they can share. So that time sometimes what happen, they need to fight for the nutrition. Okay, but in your case, I can see that they are sharing separate, they have separate amnion and chorion. Okay, that is a good thing. And so like already during pregnancy, your body demands increases as you need enough nutrition for you and also for your baby. But in your case, as this is twin pregnancy, so your body demands more. That's why you need extra care. And there is so we call this type of pregnancy like high risk pregnancy. So you need like more frequent visit in the more frequent visit, and you need and did you take the folic acid?
Yes, doctor.
Okay, that's good. And you need more frequent visit, like you need the next visit in the 32 weeks next ultrasound, and we might do extra scan or extra follow-up for you. And from here on, I will refer you to the high-risk pregnancy clinic where you will be seen by the specialist. They will take care of you and your baby more frequently. And you need to increase your you need to increase your you need to take food more, like healthy food. And I want to ask you few more history. Is that all right?
Yes, doctor.
Okay, so is this your first pregnancy?
Yes, doctor.
Okay, and like do you have any family history of any twin pregnancy?
Yes, doctor. My aunt has twin history.
Okay, and like any complication or anything happened at that time?
No.
Okay, that's good. And any history of any congenital or birth defect?
No.
Did you do the Down syndrome scanning?
Yes, doctor. I did.
Okay, are you regular with your antenatal care?
Yeah.
Okay, and like so, right now you don't have any like any other symptom like breathlessness or tummy pain?
No.
How is your pee and poo?
It's okay, doctor.
Okay, that's good. So as why and one more question, do you have any diagnosed medical illness like diabetes, hypertension?
No.
Okay. So in twin pregnancy, like you need to do the do you have any like thought about your delivery? How do you want to go for delivery or higher?
No, doctor. It's already, I think, like that.
Okay, so like as I told you, like here on you will be in the high risk pregnancy clinic, and a specialist will talk about with you, and they will do more frequent follow up. And for twin pregnancy, like there can be early delivery. If everything is all right, it can be normal vaginal delivery. But like a specialist will decide that if anything goes wrong, they might go for the cesarean section. Again, it will be depends on the like baby's growth and your pregnancy progress. And um, And you need to you need to be regular with your vitamins and the healthy food. You need to follow the healthy diet and do little bit of walking, and you need to avoid the smoking and any smoking, alcohol, any soft cheese, um, and you need to be careful about the seafood. Are you with me?
Yes, doctor.
Do you have any specific concern regarding this?
Anything that I need to know?
Okay. Like as twin pregnancies, high risk pregnancy, there can be like bleeding at any time of the pregnancy. Can be antenatal bleeding, or it can be early rupture of your membrane. So if at any time if you see any bleeding or any abnormal fluid from your lower part, you need to definitely like go to the emergency as early as possible. Or if at any moment you feel that your baby is not moving properly, you need to go to the emergency.
Okay. Okay. Dr. Aki,
So it
yeah.
was haphazard, sorry.
Otherwise, it's okay. Like you try to cover. Yeah, just I would say it's a bit haphazard. You need to just explain as a systematic way. And I feel like if you forget to take history, that's okay to ask later on. There is no harm. But when you are going to explain management or counseling regarding twin or any like pregnancy counseling related case, please make sure you are asking, you are mentioning about complication. What complication can happen to the mom? What complication can happen to the baby as well? Okay.
Yeah, I missed the complication.
Otherwise, it's okay. No worries. Yeah. So let's discuss the case. 32 years old Mary attends your GP clinic. She's 20 weeks pregnant and has come to discuss the result of the ultrasonography that she did 1 week ago, and the scan showed a twin pregnancy with each fetus having a separate amnion and chorion. So your task is take a further relevant history, explain the scan result to her, and discuss the further management regarding her pregnancy. So it's a twin pregnancy counseling case. Again, same introduction. You can ask like, how may I help you today or whatever. Then from the note, you can mention that from the note, I can see that you are here because of your scan report. May I ask you a few more questions? Was it a planned pregnancy or is it your first pregnancy or not? Because it's a twin, so please ask about, was this a natural conception or did you go for any artificial method of conception or are you taking any pill for that? Okay. How about your pregnancy going so far? Are you experiencing any tummy pain, any bleeding? Basically, all second trimester related complication questions. Okay. So any tummy pain, bleeding from down below, burning, stinging while passing urine, any fatigue, any headache, blurring of vision, swelling, fever, malaise, you should ask details. Okay. And have you started feeling baby kick or not? If you notice like it's a patient coming early, you can still ask about any early weeks pregnancy symptoms, any exaggerated vomiting, nausea, because patient gives scan showing it's a twin pregnancy. You can ask those history. Okay. And how about your antenatal checkup? Are you regular with that? Have you done blood test? Any abnormal report? Did you take folic acid? Those things you can ask. Okay. How about your appetite? Have you noticed any weight gain, weight loss? How about your exercise, bowel habit, any problem with that? Did you take vaccine? Your vaccine is up to date or not? You should ask those questions in history. Now, important thing, because it's a twin, you can ask about any family history of twin. Okay. Are you taking any medication at this moment? If you notice patient is taking any medication, you should ask why you are taking it. Okay. Any allergies, sadma, past medical surgical history, especially any diabetes, any clotting problem, any epilepsy, thyroid issue, blood pressure level. You should ask, do you have enough support? Very important question. Do you have enough support? What about your blood group? Have you done your pap smear before or cervical screening before? So those are your history. How you are going to explain a scan report to your patient? So you can ask your patient how you are feeling about your pregnancy. So your patient is very excited. You can mention like, look, there are different type of pregnancy. There are based on your scan, what we notice, it's a twin pregnancy. Okay, so give it a pause and check your patient reaction. If your patient is so happy, like definitely you can congratulate her, but it depends on your patient expression. Okay, sometimes patient might be concerned about like next step. So you can mention like, look, I'm going to explain details about your twin pregnancy. Okay, there are different type of twin pregnancy, but your one is the most favorable one because your two baby, they are they are having separate placenta as well as they are having separate bag for them. Okay, so actually they are independent twin pregnancy, and the prognosis is really good. Okay, it is very likely that this could be non-identical twin. Okay, but I'm also a bit concerned about your pregnancy because many women who have twin pregnancy can go through a normal pregnancy, normal delivery. But as you are carrying twins, so there could be a risk of multiple pregnancy. Sorry, multiple babies risk. So what could be the complication? So complication to the mom and complication to the baby, you need to mention. For the mom, you can feel bit tired, exhausted as the pregnancy goes by. Okay. Also, there is high risk of blood pressure that can cause preeclampsia. Sometimes there is high chance of developing diabetes during the pregnancy, and your tummy will be bigger towards the end of the pregnancy. You might feel short of breath for that. There could be risk of antepartum hemorrhage or bleeding during the pregnancy, cord prolapse can happen, or risk of postpartum hemorrhage can happen. And the complication of the baby, because there is twin, so low birth weight, intrauterine growth restriction can happen, birth defect, malpresentation can happen. Okay, but don't worry, we will monitor you and your babies for those complications. That's why I'm going to refer you to the high risk pregnancy clinic for better management. Definitely multidisciplinary team approach. So from now to onwards, you need to go for more frequent checkup every 2 weeks until 28 weeks, then weekly until your delivery. Okay, and from each visit, they are going to check your weight, blood pressure, and also they are monitoring baby's condition. As usual, sweet drink test at 28 weeks to rule out any diabetes, repeat blood test to check any anemia. They are going to do repeat ultrasonography every 2 weeks from 28 weeks and CTG to check baby's condition. Okay. They are also going to do back test to make sure that there will be no infection during or after the delivery. So delivery, do you have any plan for the delivery? You can ask to your patient. If your patient has no plan to deliver, you can mention delivery will be planned at 38 weeks, and there are two options for that. Okay, maybe cesarean section or normal vaginal delivery. But for normal vaginal delivery, we are only going to try for that. Like if your baby's position, like is in cephalic position, second baby should be less than 500 grams compared to the first baby, like that you can mention to prevent any obstructed labor. But don't worry, your delivery will be done in a tertiary hospital under the guidance of the specialist. Okay, where continuous monitoring of the baby will be done via CTG during the delivery. So it is better to stay near to the hospital during the last weeks of your pregnancy. You can mention, and also you can advise your patient that you need to take healthy balanced diet, for iron, calcium, folic acid supplement. Okay, but anytime if you experience any tummy pain, bleeding, or if you don't feel BBK, just come to the emergency department. Okay. So when you finish, try to finish with the 4R. Okay. So that is mention about the red flag, further review, routine checkup like that. If need, refer and reading materials. If twins or multiple babies, so you can still advise to take supplement. Okay. Any questions from this case? If no, we can move to the last case. Yes, you can mention about vaccine regarding influenza and whooping cough. Yeah. And now also COVID vaccine you can add. Okay, who will be the next one? Dr. Raisa, you wanna perform? Okay, let's do that. Can you hear me?
Hello, Dr. Cynthia. Yes, I can hear you.
This is your case and your 2-minute starts now.
Okay, doctor.
Okay, you can start.
Okay. Hello, Mr. Jones. I am Dr. Raisa, one of the junior medical officer working in this emergency department. Nice to meet you. From the note, I can see that you're having some dizziness for last couple of months. I'm really sorry to hear about that, but please do not worry. Now that you're here, we will try our best to find out why you are having this. Okay.
Okay.
So before we begin, I want to make sure you are vitally stable with my examiner. Please excuse me for a while. Dear examiner, is my patient is hemodynamically stable to proceed further?
Your patient heart rate 72, blood pressure 130/80, respiratory at 28, saturation 94% on room air.
Thank you, examiner. So I'd like to so Mr. Jones, as you were feeling, can you tell me more about this? Since when you were having dizziness?
Last few months, doctor, I'm feeling dizzy. Yeah.
Okay. And are you feeling any shortness of breath along with it? Any difficulty in breathing?
Yes, doctor, I'm having on and off short of breath.
Okay. Is it on exertion or it occurs at rest?
Yeah, most of the time maybe on exertion as well. But I notice while I'm sleeping or while I'm lying down, I feel short of breath as well.
Okay. So is it more when you're lying down?
No, doctor, not particularly like that.
Okay. So when you walk, do you feel short of breath and any reduction in walking distance
No.
since then? Okay. Do you need to use more pillows at night?
Yes, I prefer two pillows.
Okay. So have you recently increased the number of pillows or do you need to catch up for breath at night?
No.
Okay. So do you have any chest pain or having cough these days?
I do have, doctor. Chest pain on and off, very mild, I would say.
Okay. And the location of the pain, is it central or any particular position of the chest?
No, I didn't notice it.
Okay. So have any time have you lost your consciousness?
No, but I feel very dizzy. Sometimes I feel like I might fall.
Okay. Did you notice any leg swelling or puffiness in and around your body?
No.
Okay. So do you have any medical conditions like diabetes, hypertension, or any cholesterol problem?
No.
Any heart disease?
No.
Any racing of your heart?
No, doctor.
Okay. Are you running any fever or flu-like illnesses?
No fever, no flu-like illness.
Okay. So have anyone told you that you are recently looking pale these days?
Yes, doctor.
Okay. So any bleeding from anywhere else in the body? Any history of bleeding?
No.
Okay. And does your diet contain enough green leafy vegetable or red meat?
No, doctor. Actually, I'm not feeling hungry nowadays.
Okay. So is it loss? Have your appetite been reduced than your usual one?
Yeah.
Okay. Any loss of weight and lump or bump anywhere else in the body?
Yes, doctor, I lost weight.
Okay, so how much is it intentional by any chance?
No, like around 7 kilos.
Okay, and
7 kilos. Yeah.
okay, understood. So do you smoke or drink alcohol?
I do smoke, doctor.
So may I know how many cigarettes per day for how many years?
20 cigarettes per day. Maybe more than 40 years.
Okay. So do you drink alcohol or take any recreational drugs?
No, just in the weekend, alcohol.
Okay. So are you coughing up any sputum?
No, I'm having dry cough, but no sputum at all.
Oh, okay, understood. Okay. So do you have any are you on any prescription or over-the-counter medication?
No,
Any known allergies?
no.
Okay. And thank you so much for all the information. Now I'd like to examine you. So is that okay with you?
Sure.
Okay. So dear examiner, I'd like to perform physical examination on my patient, starting with general appearance. Is my patient comfortable or distressed? Is there any pallor, icterus, any cyanosis?
Your patient is normal looking.
Okay.
Patient, yeah, your patient looks thin or thin.
Okay.
No pallor. What other things you mentioned?
Any clubbing, cyanosis?
No,
Any sign of lymphadenopathy, any edema or dehydration?
no,
Okay. And I'd like to know the BMI of my patient.
not done yet.
And I'd like to do mainly respiratory system examination. Is there any sign of respiratory distress, like nasal flaring, intercostal recession, excessive muscle use of neck?
No,
And any raised JVP or carotid bruit in the neck?
no,
Is there bilateral is the chest expansile on both sides? Any restriction of movement?
so you can appreciate there is a decrease ERNT in the right lower upper lobe. No active sound.
Okay. Now I'd like to on the auscultation, is the heart sound S1 is audible?
Yes,
And any added sound like murmur or pericardial rub?
no,
Okay. Sorry, may I know the vocal resonance or vocal fremitus, if possible?
not done.
Okay. So I'd like to complete rest of the systemic examination. And is there any leg edema or
No,
dependent edema in the sacral ear?
no.
Is there any office test available for me? Like,
You can order and your time's up. Okay. So Dr. Isa, approach was very good. History, nice. You asked me nice history, but my question is that later on, I think you forget about your patient history of presenting complaint. The patient
Yeah.
coming with increased dizziness. So did you rule out other causes, any brain-related cause you ruled out, or any neurological cause you ruled out? I feel like you just missed that one. Otherwise, like fantastic. You asked me about respiratory related question, which was positive findings. As I mentioned, to be honest, like these things happen every time. So if you are concerned about any cancer, please ask your patient, do you have any past history of cancer? Okay. So you asked me about diabetes, high blood pressure, everything. Please try to ask like, do you have any history of cancer? I know it sounds very silly, but like many patient and also in clinical, I noticed like if you are not asking particularly, they are not giving you answer. Okay.
Okay. Okay,
So
thank you.
your patient has a history, like past history of lung cancer. Now patient again develop like excessive short of breath, coughing, weight loss, and also patient develop dizziness. So that also leads to like you might suspect with any brain mets from lung cancer.
Yeah, sorry.
That's
I totally
okay.
missed the
I know
scenes.
like it's really very tough to think about all that differential, but actually this case came. So as it came, so we need to think about like, and we need to correlate. Okay.
Sure, thank you so
So
much.
yeah. So let's discuss the case. You are a junior doctor working in the rural emergency department. Your next patient is Mr. Jones, 89 years old retired accountant, who present with increasing dizziness for a couple of months, which severely reduced his daily activities. So task is take a relevant history, examine the patient, explain the possible diagnosis with relevant investigation if you want to order. Okay, so in this case, so history of presenting complaint, same you need to ask about, introduce yourself nicely, how you are doing today, or how may I help you. So basically patient is coming here with dizziness or drowsiness. So ask details about, can you please tell me more about your dizziness? What exactly happened? Do you think room is or world is spinning around, like to rule out any vertigo? Okay, or do you feel lightheaded? From sitting to standing, you feel dizzy, or you feel dizzy all the time. Okay, before dizzy feeling or dizziness, did you have any nausea, any vomiting, any strange smell, any blurring of vision, any recent history of fever or infection, any weakness, right or left side weakness, any tingling, numbness sensation? Okay, so come to the systemic question. So you can ask about how about, because for dizziness it can be related cardiogenic. So you should ask about any chest pain, palpitation. So here chest pain positive. When you notice chest pain positive, but that is the chronic, you should ask about any exertional chest pain. When you ask about exertional chest pain, you should correlate with exertional dyspnea as well. So basically, patient gives you vague symptoms about chest pain, but exertional dyspnea positive, and also short of breath, cough positive, but there is no pedal edema. Okay, ask about any blood mixed with sputum or not. Then ask about any tummy pain, any nausea, vomiting. Okay, how about your bowel habit, any urinary symptoms? You should ask. And then you can ask about for dizziness related, you can ask about for diabetic neuropathy or any alcohol related peripheral neuropathy. You can ask, and also you can ask about any tinnitus, any headache, any increasing anytime loss of consciousness or not. Are you using any hearing aid to rule out any ear related problem? Okay, any recent ear infection, those things you can ask. Also you should ask about any recent injury, any fall, any brain injury, you should ask. Okay, general health, past medical history, surgical history, you should ask. Okay, so past medical history, diabetes, high blood pressure, epilepsy, heart related condition, you should ask, or any cancer related question. Okay, so past medical history positive here. Patient might gives you positive history of lung cancer in the past, and patient mentioned like patient was cured from the lung cancer and didn't follow up, or patient might tell you, doctor, I forget to go for follow up, like that. Okay, so here also, you can ask about any family history of any cancer as well. Now, physical examination finding. So here, general appearance, patient vitally stable, but he looks very thin and cachet. As patient coming with you neurological problem, that is dizziness, so please don't forget to ask me about neurological findings. Okay? So neurological findings here, most of the thing, cranial nerve, especially 7, 8, normal. You should ask about cerebellar sign, any nystagmus, any Romberg sign, dysdiadochokinesia, all are negative, but finger nose test showing ataxia. Also, finger nose test positive, and when you are checking gait, you might notice there is also ataxia positive. Okay. Another thing is that you can do Hall-Pike test to rule out any BPPV, but in here negative. Okay, you can do ER examination, especially quickly ask about how the Weber and Rini test, that is also negative. To rule out any cardiac cause, carotid bruit or arrhythmia, those are negative. But respiratory examination, here respiratory examination, there is decreased ERNT on the right upper lobe, but there is no added sound. Okay, so that is suspicious for any mass or any lesion on the lung. Now, you might ask, Doctor, how can I finish with time by asking so many questions? Look, you have to be very concise. So when you are asking me about respiratory examination, cardiovascular, neurological, I'm not going to ask details because I cannot finish with time. How I'm going to ask to my examiner, I would like to know about, instead of asking inspection, palpation, percussion, auscultation, I'm going to ask my examiner, can I appreciate ERNT bilaterally equal? Is there any discrepancy between that? Any wheeze, any crackles? Okay. Because you need to also ask neurological examination, you need to ask about cardiovascular. Same for the cardiovascular. I'm not going to ask about inspection, auscultation finding. I'm not going to ask like that. Instead of, I'm going to ask, examiner, can I appreciate heart sound dual audible? Is there any added sound, any murmur, any carotid bruit? Okay. So here, what could be your diagnosis and differential? So most likely your dizziness, when I'm going to correlate with your lung condition that you mentioned about short of breath, you are also giving me positive history of loss of weight for a long time. So I'm a bit concerned about any nasty change that coming from your lung. You had a history of lung cancer. Now I'm a bit worried about it might be spreading to the brain or brain mets. Okay, I'm concerned about it. Other condition, it could be any benign tumor on the ER, you can mention, or benign acoustic neuroma. Other differential, you can mention it might be drug induced. It might be any infection of the ER, acute labyrinthitis. It might be BPPV, positional changes, vertigo. It might be Meniere's disease. Those are the possibilities. But I need to rule out all those things. That's why I'm doing some investigation, because I'm a bit concerned about any mets of the brain. Okay. Other cause, it could be works in the ER or cerebrovascular disease. It might be any trauma, heart-related problem, electrolyte imbalance. So what could be the appropriate investigation for this patient? Basic blood. You can mention about MBC, UNE, CRP, LFT, blood glucose level check, ECG. Patient is 89. If patient complain about on and off palpitation, chest pain, you can do Holter monitor. Chest X-ray, definitely, that is our routine and basic examination. But for CT brain, you can mention, if you are a GP, you can order CT brain or MRI, but you can say, I would like to take, or I would like to discuss with my senior, and most likely we are going to do CT scan of your brain. Okay. So that's the case. In the beginning, I mentioned saturation 94% on room air. Okay, so Okay, so that's how basically I'm taking my role play session. I'm going to discuss like 6 random cases. And for the cluster-wise approach or your theory cases, that will be discussed by Dr. Arshad. I'm just taking random cases. That's actually how it comes in the MC clinical. Okay. Um, So I know it beats overwhelming for the beginner, but trust me, like after when you finish your theory course or when you are middle of your theory course, when you have like cluster-wise approach, when you know how to take a history, when you know how to take physical examination, what could be the differential? So you will feel much, confident about doing random role play. Okay. So random role play that is little bit advanced who already booked their exam or who already have their like 50% preparation done for them. But I would suggest for the beginner to attend as well because you can have the idea how the case will come in clinical exam. Okay. I hope you enjoy my session, but anything, any confusion, any question, if you have, feel free to ask me. Um, as I mentioned, I'm Dr. Cynthia. I'm working Australian health system for last 2 years, and also I passed my clinical, definitely MCQ and clinical in my first attempt. My history is a bit different. I took preparation for fully, I was prepared fully for face-to-face exam, but I ended up with online. So I have idea for both exam system. Okay. So if you have any question regarding exam, feel free to ask in this chat box. Okay. For Pete's cases, like if mom is present, you can ask mom to the history, or sometimes they mention like patient is capable to give you history. That time you can ask history from the patient. It depends actually, okay? And it will be mentioned clearly on the stem to whom you need to take history. For online and face-to-face exam, yeah, the pattern is a bit different from both format. And for, I would suggest like for online and face-to-face, both they have their own pros and cons, but you have to choose like whatever you are going to prefer your exam pattern. But the preparation is similar, I would suggest. Yes, for online exam, actually, that is for a day-long exam. You might need to sit in front of the computer like almost like 6 to 7 hours because usually exam started from 9. Basically, main exam started from 10, but you need to be open your Zoom, everything from 9, and exam will be finished around like 4 p.m. And in between, you will get lunch break, 30 minutes lunch break. But for face-to-face, it will be like within 3.5 hours. Okay. So after that, it's finished. So for the oxygen saturation, if your patient respiratory rate is okay and saturation 94% room air and that your patient baseline, so that's okay. But it depends. Like if you notice like patient saturation dropping for them, you can give oxygen for the comfort, okay? And for the COPD patient, again, not all the COPD patient like saturation dropping, but basically for the COPD patient, our aim should be like more than 88 to 92%. That is the aim, but it depends. We need to check patient saturation trends. Okay. So if patient is comfortable at this moment, respiratory rate is okay, saturation 94% on room air, your patient is capable of talking full sentence, not short of breathing at this moment, you can still proceed. But if you feel saturation dropping, your patient showing work of breathing, you can mention like, I can give you some oxygen just for comfort. Okay. And another thing, always remember, it's not MCQ, it's clinical. So for MCQ, you have to choose particular answer, like either A, B, C, whatever. But for clinical, it's all about your approach, communication. Okay. So knowledge, definitely you all have the knowledge from your MCQ, but clinical, you need to correlate all of your knowledge along with communication, along with your approach. Okay. So if you are not sure about either should I do it or should I not, if you are concerned or if you are confused, you can still mention that I'm going to discuss with my senior and I'll let you know. Okay. Uh, for online exam, yes, they are checking all of your, so you have to show your room, you have to show your desk as well to make sure there is no books in your room. And you need to open your audio video all the time. There is no option for mute. Okay. Okay. So I think that's all for today. And my next class will be Sunday, same time. Okay. So good night, everyone.